Thank you for joining McLaren Northern Michigan today for the first of our 4-part virtual orthopedic education series. Today's session is being presented by Dr. Angus Goetz, orthopedic surgeon. Dr. Goetz will discuss arthritis and non-surgical options to relieve pain and reduce limitations. For the duration of the presentation, all participants have been muted. If you have questions, we encourage you to submit these using the chat feature. These questions are only visible to the moderator. Dr. Goetz will answer as many as he can at the end of his presentation. For additional questions, to schedule an appointment, and/or for follow-up information, we encourage you to use the links that will be found in the chat box. All registrants will receive a follow-up email after the event that will contain these links as well. Thank you again for joining us. Now, without further ado, Dr. Goetz, take it away.
My name is Dr. Angus Goetz. I'm excited to join you today to start our inaugural education series in orthopedics. Today, we're going to talk about arthritis and arthritis management, with the priority today being conservative measures prior to discussing possibilities of joint replacements. But I will do a short foray at the end of the talk to introduce joint replacements as well. Many of you may know me from my previous career at Orthopedics, which spanned from the mid-90s until around 2008. We went to Jackson Hole, which was a great adventure, but returned here to Petoskey in Northern Michigan for this great opportunity and for family. With no further ado, I'm going to start with our talk about arthritis and arthritis management. All right, what is arthritis? Arthritis is simply a term which describes the condition of inflammation of the joints. There are several different major types of arthritis, which we'll talk to today, and all of which result in the same endpoint, which is pain, swelling, joint damage, and deformity, which results in limitation to activity and lower quality of life. Today, we're going to talk about how to improve your quality of life with your diagnosis of arthritis. Most people don't know that there are over 100 different types of arthritis known in humans. In fact, there are over 120 different types. But we typically will look at arthritis in certain subcategories or subtypes. The most common by far is wear and tear arthritis, commonly called osteoarthritis. But there are other types of arthritis as well, called inflammatory arthritis. For example, rheumatoid arthritis, or ankylosing spondylitis, or Sjögren's, or other inflammatory conditions which destroy the joints and can affect the whole person as well. There is arthritis due to infection, which is called pyogenic arthritis. And that type of arthritis can occur if you develop an infection in some place and it spreads to your joints. It can be a very significant, life-threatening condition. There's also arthritis due to trauma, and oftentimes we see older individuals who have sustained trauma, but sometimes young people too, where they have a broken bone, for example, that involves their joints. And that broken bone causes abnormal stress in the joint, which leads to joint degradation and cartilage loss. And there are arthritis due to genetic diseases. For example, rheumatoid arthritis has a genetic mediation. So does gout, which is a crystalline deposit disease, which has a genetic component to it. And other systemic diseases, for example, lupus, can result in polyarthralgia or polyarthritis of the joints, which means multiple joints involved at the same time. In the United States, arthritis is a significant socioeconomic problem. The impact in the United States includes that it is the most frequent cause of disability in adults in the United States, which I think is pretty significant when you think about that. Over 27 million adults are diagnosed every year in the United States with some type of osteoarthritis. In 2009, which were some of the latest published data from the government, osteoarthritis was the 4th most common cause of hospitalization in the United States. And for me, that was amazing to me. But I do recognize that that represents the diagnosis, but also the treatment of arthritis, such as medications, physical therapy, and surgical procedures to address the arthritic joints. In 2010, approximately 3 million knee replacements were performed in the United States every single year, and 1 million hip replacements were performed. 50,000 shoulder replacements are performed annually in the United States at the last available data. There are other joints, however, that are replaced or operated on, and those include ankles, great toes, digits, for example, your fingers, elbows, etc. We even do disc replacements for lumbar and cervical disc disease to assist in arthritic conditions of the spine. The cost of treatment of osteoarthritis yearly is in the hundreds of billions of dollars in the United States. That's a staggering amount. And it represents about 5% of our entire United States domestic product in the treatment of osteoarthritis. So it is a significant financial stress on the patients and on the United States system. With that said, I'm going to launch into a short foray into conservative treatment alternatives. There are multiple different medications. There are multiple different modalities to help reduce the symptoms of arthritis. Unfortunately, in most cases, we do not have, quote unquote, a cure. However, we do have treatments available to assist in the discomfort, deformity, and stiffness associated with arthritis. Number one, I don't have to tell you that weight gain can exacerbate arthritic complaints. And as the Americans get a little heavier, it can confound their symptoms of arthritis. So as a physician, I often would recommend a 10-pound loss of weight. And I'm going to tell you why here in a little bit. A 10-pound weight loss per year is equivalent to removing about 40 million pounds. That's 40 million pounds of stress on your joints per year. And the way I get to that is that every pound of weight loss decreases stress on the joints by a magnitude of 4 during the walking cycle. So if I lose 1 pound, for every pound that I press on the ground presses back on me. I'm going to use me as an example. I weigh about 200 pounds. So every time I press on the ground, I exert 200 pounds on the earth. The earth exerts 200 pounds back on me, so I don't throw the earth off the orbit. And for me to locomote, it's about 2 times my body weight as a force to generate that power to locomote. So if we go back to my example, if we lost 10 pounds in 1 year, it would take 40 million pounds off your joint. That's a staggering number. So one of my premier things is, hey, lose 10 pounds, and it quite likely will help you. You can do that with several different types of activities. I'm a big fan of non-weight-bearing things such as swimming, where the buoyancy decreases your weight. Biking, I'm personally a big biker. And during my foray with arthritis, which I'll share with you a little bit, I went from running to biking. I also recommend yoga for flexibility and to prevent stiffness and keep your limbs moving and supple. Hiking, Pilates, all those things are beneficial to decrease weight and to increase muscle strength, which decreases the amount of force on your joints. Medications are commonly used, and we use them in our office, and usually they're oral and or intra-articular. I have an example here that I'll show you here shortly. Non-steroidal anti-inflammatory medications like Motrin and Aleve are commonly used to decrease inflammation in arthritic joints. Tylenol is a pain inhibitor that decreases symptoms, although it does not necessarily address the inflammation. It can improve an NSAID in decreasing your pain. Current recommendations from the American Academy of Orthopedic Surgeons are Aleve or like medicine, but I'll use Aleve as an example. Aleve over the counter, 2 twice daily. That's 2 with breakfast and 2 with dinner, and or Tylenol extra strength in divided doses, not to exceed 3,000 milligrams a day. You should discuss with your physician whether those medications are appropriate for you, however, and they should be adjusted if you have kidney disease or liver disease. So it's important to disclose previous medical problems with your orthopedic surgeon so that he or she can make appropriate recommendations. Either of those medications can be used as a PM dose, i.e. Aleve PM and or Tylenol PM, which has Benadryl in it, which can help you sleep if you're uncomfortable at night. There are other medications called COX-2s, which you may have heard about, which are a class of medications that are anti-inflammatories as well, but they are a different molecule than Aleve or Motrin. They often are more gastroprotective, meaning they have less GI upset, and some are metabolized by both your liver and your kidney. So it can be beneficial in helping to protect your vital organs, your liver and your kidney. Some medications may be used topically to decrease pain, such as Icy Hot or Bengay, which has a medication which you feel the hotness to it, which decreases your perception of the pain, and or Aspercream, which actually has aspirin in it, which can also decrease the inflammation topically through the skin. Corticosteroids are something that we use frequently to decrease inflammation. They can be administered intra-articularly or orally. In my practice, I give a lot of, quote, steroid shots, end quote, for people that have acute flare-ups of their inflammation as part of an overall treatment plan for significant osteoarthritis. It can decrease inflammation, therefore decreasing the pain and the swelling and the stiffness associated with your arthritic joint. Too frequent or too much corticosteroid over time, however, has demonstrated increased joint deterioration and should be used judiciously and should not be an everyday type treatment for the joints. But we use that for flare-ups and for significant arthritic conditions appropriately and as needed. There's something else I want to talk about, which I forgot the slide, and that there are several different types of oral natural anti-inflammatories. We often recommend talking to patients about seeing a homeopath, for example, or going to their pharmacy and asking for natural anti-inflammatories, such as turmeric or curcumin or other medications. CBD has been approved for osteoarthritis, the relief of osteoarthritis as well, topically, and I won't talk about the ingestible or the smokable at this time. But CBD can be utilized and can be effective in decreasing joint pain. There are, since we were talking about intra-articular injections with corticosteroids, there is an alternative medication which can be used as well, and that's called hyaluronic acid. I actually brought some today, so I'll show you how it works. But there are common brand names, including Synvisc or Hyaluron or Orthovisc. There are multiple different types, but they're all basically the same. It is approved by the Food and Drug Administration for application for osteoarthritis of the knees. It's not approved for rheumatoid or some of the inflammatories, although it may work. It can work in other joints, but most commercial insurances will not pay for it unless it's for osteoarthritis. Generally, those medications are temporizing, non-curative, but can be very effective for early to moderate osteoarthritis of the knees, which is the joint that it is approved for over a period of time. And in my practice, it is a mainstay of our conservative measures. It can also work in other joints, but at this time, it is not approved by most insurance carriers for other than knees. The disadvantages of that application, however, is that it can be expensive, and there have been reported infrequent episodes of delayed hypersensitivity, which means with repeated applications of that medication, it can cause an allergic reaction, which can be quite uncomfortable and often needs further treatment, such as taking that fluid out or administering steroids to decrease the inflammatory response. And since I have your attention here, I just brought some here so you can kind of see what it's like. This is hyaluronic acid. It comes in a syringe, which we place a needle on, and then we inject it into the joint. It is very, very viscous, like almost a jelly, and it is very, very slippery. But what it does, I don't know if you can see that, it will fill in the fissures associated with the cartilage loss and lubricate the joint and decrease the amount of friction, and it's an anti-inflammatory. So it's a good method used frequently in the conservative management of joints as an injectable. There's some conservative treatments that are available too, and these may include arthroscopy, where you put a small camera in the joint and remove diseased tissue. We can smooth the cartilage if necessary, the shoulder, knee, hip, even the small joints, elbows, ankles, etc., which decreases friction and can give people some relief. We do some procedures which are bony realignment procedures, which are called osteotomies. They're not very commonly performed in the United States when compared to other countries like Europe. What that does is it changes the force of the joints, and therefore preserving the joint and decreasing extra stress on the joint.
Okay, Dr. Goetz, thank you so much. We have a few questions that came in. So I'm just going to start with the first one. What is the current state of cartilage regrowth?
I think cartilage regrowth is a technology that continues to improve. We can take cartilage from your joint, and we can cultivate it and culture it in a petri dish, if you will. We typically will send it to a company that will help proliferate that. It is effective for individuals that have localized cartilaginous lesions. For example, I actually brought a model here, and so I'm going to show you an appropriate application of that. In this model, you may see areas where there are holes in the cartilage. Those would be these little deficits, for example, at the tip of my finger. You can get cartilage either from yourself and send it to the laboratory, where they will create more cartilage, and arthroscopically or through small incisions, we're able to take that cartilage, place it back into that deficit, generally recover it with some type of membrane, and allow that cartilage to grow. You can also perform a procedure called a chondroplasty, where if you have a small focal lesion like that, we can take a burr and burr the diseased cartilage away down to bare bone and create another type of cartilage called fibrocartilage to fill that deficit. Although fibrocartilage is not as effective as articular cartilage, it is a way to cover bony lesions and provide some relief.
Great, thank you. Do you have any experience with arthritis that is likely a result of a round of, and forgive my pronunciation here, but chloramethylical treatment given in the late 1970s for the treatment of meningitis?
No, I can't say that I know very much about that, but good question.
Okay. We had a comment here. An individual, he or she had some bariatric surgery and lost a significant weight, but actually found that the joint pain got worse for this individual. So they're asking, how can one lose weight if they are so sore from joint pain?
I often recommend non-weight bearing exercises like swimming, for example, riding a stationary bike, riding an elliptical, something that will take the weight off the joint. As I said, I'm a big fan of pool therapy, bicycling either outside or on a trainer. Those are ways to unload your joints so that you can move them more comfortably. In addition, if you're going to do those exercises and anticipate discomfort, we can go back to the pharmacological treatment, take a couple of leaves an hour before with some Tylenols to decrease your inflammation and discomfort, which will allow you to exercise more.
All right, what is your opinion of prolotherapy for treating arthritis?
Prolotherapy is an interesting and emerging type of treatment. Its idea is to create somewhat of an insult to create a regenerative process. I think that is similar to dry needling and physical therapy, things like that. There are ways to try to stimulate a healing process. It is used for arthritis. It's utilized for chronic tendinitises and other conditions. So it's a way to use your own body to create a healing response with a stimulation exerted on the body to try to create inflammation to facilitate healing.
Thank you. Just a couple more here. Can you speak about the state of some of the regenerative therapies, such as platelet-rich plasma injections or stem cell injections?
I can. I think it's important to know that a lot of insurances currently have not jumped completely on that bandwagon, so their willingness to pay for it can be limited. Number two, in my own personal practice, I use platelet-rich plasma, usually your own plasma, to in combination of therapy like acupuncture or dry needling, where we stimulate the tissue that we want to have healed, like a tendon, for example, or a meniscus, for example, in the knee, and inject your own stem cells in there. The data is emerging. I think we're early in our investigation in terms of its efficacy, particularly over the long term, whether or not it creates cartilage that will endure for the long period of time. So I think that it is an active area of investigation. I think that we are, myself included, are easing into the biologicals in terms of facilitating your body to heal. I think there's a lot of work still to be done until I can inject some PRP or other cells in your knee. Those cells know where they're supposed to go and they know what they're supposed to make. We have to learn that better in terms of a treatment that's viable in the long term.
Great, thank you. There's a few more questions, but because of time, we will respond to those questions via email. So please know that we will get to your questions and get them answered and get those back to you. I want to thank you for joining us today. And just a reminder, there are 2 links in the chat box. One is for you to submit additional questions or to request an appointment. And the other is to register for the remaining 3 virtual orthopedic sessions that we have in this series. These links will also be sent to everyone via email. Just a reminder, the next session is 2 o'clock on Tuesday, April 27th. That'll be with Dr. Christopher Kennedy, foot and ankle surgeon, and he'll be discussing bunion treatment options.